I'm Vic Perry, and welcome to the Future session. I'm a health promotion officer with Living Positive Victoria. And before we begin, we'd like to acknowledge and extend our appreciation to the traditional custodians of the lands upon which we're all meeting. And we pay our respect to their leaders and elders, past, present, and emerging, for they hold the memories, traditions, culture, and hopes of all the peoples of these lands. So welcome everyone to this session. This is the second of the Future sessions. In this session, we'll cover multicultural experiences of HIV. A little bit about these sessions. These sessions are an opportunity for you to hear about your input in the Future survey, how it's been collected, analysed, and ultimately used by HIV service providers and educators. And importantly, you'll hear about the important issues facing people with HIV today. Finally, you can also contribute and shape how the Future survey is developed in years to come by getting in touch with us. Joining me in this series is Dr. Jen Power from the Australian Research Centre in Sex, Health and Society, which conducts this Future survey. Jen is the lead researcher on the Future study. Welcome, Jen.
Thanks, Vic.
And for this session, we're also joined by Emile Canata and Christian Cortez from Living Positive Victoria. Welcome, Emile and Christian.
Welcome, thank you.
Everyone.
So, Emile and Christian, firstly, tell us, what do you do at Living Positive Victoria? And then what roles do you have in the multicultural space?
Oh, yeah. Hi, everyone. So my name is Emile. My pronouns are he, she, and they. I'm the peer navigator at Living Positive Victoria at the moment. So a lot of what I do with my work is connect with people who are newly diagnosed with HIV or coming to terms with their diagnosis. As part of their role, I also create programs, workshops, events that basically addresses their needs. I'm also the Gen X coordinator, which is essentially the PLHIV under 30s group under Living Positive Victoria. And I'm also a part of PANA, which is this new group that just opened up last week. It's a Positive Asian Network Australia. In terms of my citizenship to the multicultural space, I suppose in some ways I'm part of the queer community. I am part of the Filipino community, but I can't say that I'm quite connected to it. So most of the spaces that I am part of are usually like Black, Indigenous, people of color, kind of queer communities that I'm quite connected to, and the positive colored communities as well, particularly around the Asian migrants.
All right. Thank you, Emile. Christian.
Yes, my name is Christian. My pronouns are he and him. I'm the business support officer for Living Positive Victoria, although my job is more on the realms of operations and technologies. I do support a little bit of the peer support program when we have people from Spanish-speaking backgrounds. So that's what I come across with the multicultural aspects of living with HIV and people living with HIV from specifically Latinx and also the Iberian Peninsula community, because I have seen like clients that they identify as Hispanic, but they don't necessarily are from Latin America. They could be, Spaniards or Portuguese. So I've been with Living Positive Victoria for a long time now. And since I started with the organization, I kind of was well known in the sector as the person that knows Spanish. And sometimes we had several clients that they needed support, particularly international students, and they come through me. Through that, back in like probably from 2013 to 2017, I decided to start a Latinx LGBTI project. And within that LGBTI project, there is a part that focuses on HIV. So we established a group of Latin Americans in Australia living with HIV. It's not specific to LGBTI also, because we had some couples that identified as heterosexual, and they've been part of the group. The group has been kind of stable and growing.
All right, that's good, Christian. Thank you very much for that. And it's exciting how the group has evolved over time. So thanks for those intros. And now, before we get right into the conversation, Jen, how about starting us off with talking about the HIV Futures 10 study?
Sure. So HIV Futures, for those who aren't familiar with it, it's been around for a long time. It's a survey of people living with HIV. It's a national survey. We're funded at La Trobe University to run this study. We're funded by the Australian Department of Health. And one of the reasons they fund this study is because we collect a lot of information that's related to quality of life. And that's a very broad definition of quality of life, but we look at things like financial security, housing, mental health, physical health, relationships, social connectedness, and sort of that broad sweep of issues, I guess, that might affect someone's quality of life. And the National HIV Strategy at the moment has an indicator in it related to quality of life. So I think it says 75% of all Australians living with HIV will report good quality of life by 2022. And because they've committed to that, they collect data to inform how well we've gone against that indicator. So HIV is set up to do that, but also we really function to provide information for the sector. So there's a lot of questions or data that we collect in there related to service use, how people feel about service use, what would be useful, and so forth. So that data we make available as much as possible to community services and clinical services and other services in the sector. We try and essentially we look at it as a study that supports advocacy and supports community service delivery as much as possible. So we've been running HIV Futures since 1997. The study began in 97, which was a big year in the history of HIV because that was the year really we had access to combination antiretroviral therapy. And it really just changed what the sector had to pay attention to because suddenly people were likely to live longer. People who had been very unwell, who thought they might die, were now looking at, rebuilding their lives, looking at going back into the workforce, looking at what living long-term with HIV might mean financially, in terms of relationships, in terms of career. Hence the name HIV Futures. It was really about looking at the future of HIV in this treatment era, I guess. And we've continued the survey periodically, so every 2 or 3 years since then. So we've now got this awesome data set, really looking at the experiences of people living with HIV in Australia over the last 20 years or so. We normally hear from between 800 and 1,000 people, which is, anywhere between 1% and 4% of the population of people living with HIV. We're currently collecting data for HIV Futures 10, which is the 10th iteration of this survey. We'd really love to hear from people all over Australia. There is an online survey, and if you go to hivfutures.org.au, you can complete this online, or you can, there's contact details for you to order a hard copy version of the survey, which is this little number that looks bigger than it actually is. We've been told it takes about half an hour to complete it at the moment. Or if you're working in the sector, we'd just love your help to promote the study. So if you're talking to people or running an event, it would be awesome. We're happy to provide resources and info. The other thing we're doing, and I'll talk more about this as we chat, but we're very aware that HIV Futures, it's quite a long survey. It requires a reasonable grasp of English to complete, and it always has. And it's been, we do get a reasonable representation of people from non-English speaking and migrant backgrounds, but language is a barrier. And also I think a survey can only collect a certain amount of data, like it's a ticker box survey. And there's a lot of complexity and nuance and experiences related to migration related to connection with culturally diverse communities and living with HIV that we just can't capture in this study. So we've opened a qualitative study to augment HIV Futures this time around. We're very aware that a lot of studies of migrant experiences of living with HIV tend to sort of collapse everyone into this overseas born category, and we tend to get studies that are a little bit meaningless because there's so much diversity in that group that we really can't, you know, pinpoint the needs or experiences of any one group. So we consulted the sector, and it was suggested that in this iteration of Futures we could focus on Asian born gay and bisexual men living with HIV. So we are at the moment conducting interviews with this group of people. And I have put the details on the screen there. If you go to that Futures interview link, you can get more information about that study. But we're essentially looking for people to participate in interviews, which will be, they're peer-based interviews conducted by NAPWA, and you get a $50 gift card for that participation. So that's the HIV Futures 10 study as it's happening at the moment, and I'm very happy to answer questions.
Okay, so Jen, I guess we can start a conversation and let's bring in Emil and Christian, because you mentioned that I guess one of the challenges has been with Futures is engaging with people, and I guess it's about English being a second language, it's about cultural background. So I guess, yeah, bringing Emil and Christian in, you know, how would the study have a potential to engage? I mean, looking at what the current research and how it's done, how would it be best done to engage and to make it something really useful for people from different cultural backgrounds or linguistic backgrounds?
I think we kind of like organizations like Living Positive Victoria and other positive peer organizations have a very, very powerful role in this, because a lot of us are connected to the ground and engaging with a lot of very diverse communities. I know, for example, on my hand, I've connected with over 30 something international students over the past year under different experiences as a positive person. And through that, I've been able to engage them through writing articles for us, or being present in other events and getting involved in other workshops or events that may cater to them. So I feel like being connected and really working with peer organizations is a really key ingredient to making this work, particularly when HIV in itself is such a massive barrier already. And I know for a lot of the people that I've talked to and connected with, I'm the only person that knows about their status. So trust is inherent in that. And I think because of the cultural barriers and the sense of isolation, a lot of them already experience moving here and then being diagnosed with HIV, then coming to terms with their own sexuality or opening up to it, it's a very difficult place to be in, and understandably so. So, you know, being part of a survey or a research is really the last thing on anyone's mind, because they're too busy trying to like figure out how they're going to get treatment, what's going to happen to their migration. And I know that kind of that goes, I guess, in opposition to what the research is trying to do, because with the research, you're essentially using it as an advocacy tool. And I suppose my next question is like, is this study actually culturally appropriate for my communities?
Yeah.
And maybe a different study may actually be able to be used, because as a person of color, as someone who's Filipino, as you've said earlier on, Jen, we've just been homogenized. Like, you know, it's either you're Australian or non-Australian. And then that homogenization of non-Australians consists of how many countries, how many people of colors, and assumption that we all have represent our, you know, this bunch. So I'm really excited as a Filipino, as a community member, that we're now finally, after how many years, since 1997, that Futures has finally made space for us. But also, as a community member, I'm also really upset about it, because I'm like, well, why just now? You know? So yeah, so I guess that's kind of like where I personally really sit on it. I'm happy that you're finally making space for us. I'm really grateful that, like it's through our peer work that we're connecting and engaging a lot of this diversity into this study. Yeah, thank you.
I completely agree. It's been an interesting sort of, I've worked on futures for the last 6 years or so, and I've had many of these conversations, and often it's been, you need to tell us what people need so we can set up the services. And I would say, but I can't, because I can't access people if you can't. So I think I've really noticed the difference in terms of the sector having built more connections and more trust with different groups over the last, just even the last 5 years, to be honest. So, and I guess that may or may not make a difference in terms of research, but that sort of brings us to the next question, Emil, because again, what you said, Vic, what sort of research is needed here? To be honest, it's never going to be a survey like Futures. Like Futures just isn't the research to capture, as I was saying, the complexity of experiences and the diversity of experiences, but also, as Amelia was saying, it's not a culturally appropriate survey for a lot of people, for a lot of groups. And I think that's the real thing, like what we're missing, and I've said this so many times, and I keep saying it, what we're missing in the HIV sector, and what we miss, I think, in the research space is funding for little studies, funding for local studies that are really community driven and have a sort of participatory model. So you're not necessarily going in and collecting data, but you're running groups, or you're doing some sort of community development or community building project, and you're actually learning about people and learning about experiences in that way. And there are some examples. There was a great one, and I'm going to forget her name, but a woman in WA did it as part of her PhD study, where she worked with women who were born in Indonesia around HIV and HIV prevention. And it was a really good example of a local participatory study that really worked with community, and she was able to really understand the specific and the local needs of those women. But and I'm not saying this to sort of pass the buck, because I totally hear on, why didn't this happen sooner? There is an issue in how to fund these, because we get funding, well, there's a few issues. One, we get funding for short time periods. And as we know from research with Indigenous communities, even with queer communities, like it takes longer than that to build connection, to build trust. You don't do it as a researcher jumping in for a 2-year project or even a 5-year project. Like it needs to be a longer term investment. And to that end, I think we need to invest in the research workforce in HIV to do that. But at the moment, everyone's interested in these big studies that show how HIV is reducing and show how the cascade of care is shifting, and that's sort of almost working against local studies. So I think we need to just be a bit creative here and maybe look to
and I can hear that
more community just to help fund some of this and use the skills of researchers to, train community or support community or mentor, rather than, because big studies like Futures are not, I don't think, ever going to be the right answer.
It sounds like
I mean, we don't care and we don't want to hear from people who are up for it. It just, I think, I agree with Emil.
And it sounds like that's happening now with the National Association of People with HIV Australia, supporting groups, newly set up groups like PANA, and there'll be another group with people from Latin or Spanish-speaking communities. So slowly, I guess it's being realised that the best way to have research and use research or to build research is to actually get the communities involved in developing what the tool is in the first place and how it's used. And it may not be a simple form, or I shouldn't say simple, it's not simple, but a form to fill in, but group work, interviews, talking to people seems to be the way to go.
Talking to people, it's so simple. And I've spoken to Emil and others in the PANA network, and people in that network know so much about these issues. We need to think of that as as data, as somehow document that knowledge, that practice knowledge.
I guess we're used to thinking that, but it's easy just to have a form, and get people to fill it in, and that's it, But we know that if we want a really genuine outcome, that's not the way to do it. Christian, how do you feel like with what Emil said? Does it resonate with you?
Oh, absolutely. I think so. Emil encapsulated very eloquently everything that also applies for another community like the Latinx and Hispanic community. And also going back about, the groups that are being promoted, or the networks that have been promoted by NACWA, which is the Health Literacy Framework. It's been very interesting, and I'm really glad that an umbrella organization as NACWA finally, took, leadership into start doing more in-depth work with specific groups, because as Emil was saying, even myself, I'm, people say, oh, you're Latin American, but I'm Colombian. And it's very different, my experiences as someone from Brazil or someone from Mexico. And we all have cultural differences, even though that sometimes we could speak the same language. It's still more homogeneous than the Asian conglomerate of countries, but it's still, I cannot imagine how challenging that is. But I'm glad that we're doing these projects with NACWA. I think so. It's just the beginning, as as Jennifer was saying before. This, the good intention, to because of the demographics and the statistics has changed a little bit. Like HIV has kind of shifted on the groups that were affected, and now there is this all emergence that actually they were there, they have been there, and since I've been involved with the community, we always have, and I always was very curious about how there wasn't more maybe programs focusing to them, and I've been a very big advocate with language. I know that future is very long and it will be a really hard word to translate it, but like with Living Positive Victoria, with all programs, we create just little cards with a little bit of information, and that has been really good just to give to someone that comes for peer support, and if we have the resource in several languages, we could give them that card that is very easy language to explain, and that just helps a lot. And then like also Emil was saying, the importance of involve HIV organizations in every state, because most of them have now peer navigator programs, and if a person doesn't speak English as the first language, they could also use the help perhaps from a peer navigator that could guide them as well, if they have any questions about it. So yeah, there's a lot of stuff that could work, but I'm happy, I'm excited that it's been talked about, and that there are steps that have been taken by all these organizations to create more visibility.
Yeah. There's a couple of things there you mentioned, really important points, and Emil, you mentioned it too, in terms of peer support. It's really important that it's driven by our peers. That's crucial, because I guess it's that thing about representation means everything. And the other important point is that top-down approach. I remember I was a cross-cultural officer in 1996 or late 90s, and I was challenged, by an environment that at the time it was really difficult to do this kind of work. So I had to fight myself, and I had support from my immediate supervisor, but at the time there wasn't really much support from the structures above. So I did what I did, and I was successful at it. That's important. This kind of work really can be only successful if it's supported by the top. Has to be sort of top down. The actual development or the what happens and how happens and needs to be from the community, but there needs to be support from above. So Jen?
One of the things I thought we could do, if that's okay, is essentially, I mean, one of the things we do each round of Futures is to ask questions of people in the community, to fire questions to people, but just to get a sense of what issues we need to be attuned to. So I guess bearing in mind everything we've just said about Futures possibly not being the instrument in itself to, or the method in itself to engage with diverse communities. And so there might be other types of studies we might be able to develop to augment that. Or, you know, we advocate for those studies you know, if we can't actually make a part of this study. So all of that's on the table, I guess. But I might also just say translation is also not off the table. We had some conversations about that this time, but was sort of advised that that in itself won't necessarily make people more comfortable completing the survey. So I think that is on the table, and certainly there are different ways we could think about it, like a shorter version that's translated into multiple languages or part of the survey. So I think everything is on the table in terms of ideas. But I really just wanted to throw a broad question to Emile and Christian about what you really think the key issues or challenges are for people living with HIV when it comes to migration experience, you know, whether that might be visas, establishing life in Australia, being newly diagnosed, you know, away from home. Or, you know, what do you think are the key issues we need to be attuned to?
Well, I'm actually quite curious about this myself, and I wanted to ask you, sorry, I'm going to throw the ball back at you, but
yeah, that's fine. Yeah.
What has been your insights from doing the recent HIV Futures study on, I guess, the issues that are affected non-Australian born positive folks? Has there been any patterns? Is it quite different to the general population? Yeah, what's...
I'm going to say why I don't know this question, and then I'm going to tell you what I think. One of the things, you know, we've certainly found with Futures in the past is the diversity. You know, that we get such a diversity of responses from people. There's such diversity in the sample of people who aren't born in Australia or who have come to Australia as migrants that it's very hard to say anything universal to that experience. So, you know, we might get, you know, 2 or 3 men from Malaysia who identify as gay or bisexual. We'll get a handful of women from sub-Saharan African countries who identify as heterosexual. We'll get a few people from Middle Eastern countries. So there's a lot of diversity in there in terms of age, gender, sexuality, and just life history. So it's very difficult to know. But certainly in the conversations that we've had with people when building Futures 10, visas come up a lot, and not the visa itself, but the ways in which being diagnosed with HIV can complicate the process of getting a visa, but also sort of what it means for someone to confidently access healthcare when they're in that precarious position of not having residency, not having access to Medicare, feeling like they have to be grateful for, you know, whatever care they're given. So just that sort of fundamental human right of being able to access healthcare, being cared for, having access to medication, it sort of isn't there in the way it should be. And that's, I mean, I would just say that's ridiculous when caring for people and providing treatment for HIV is fundamental to prevention as well as human care, ethical care. So visas is the issue that's presented, but once you kind of unpack that, there's multiple issues to do with healthcare, confidence accessing healthcare, and what it means to belong, I guess. Does that ring true to
Oh, absolutely. So yeah, you kind of went to the point that it's not the visas only, like it has consequences. When you're on a visa, you are Medicare ineligible, you have issues with health insurance, you have issues with accessing workforce and access proper, that's like I also talking from my own experience as I'm now a citizen, but years ago I came to Australia as an international student, and it was a completely different experience to get a job back then to what it was as soon as I was able to access the public system. So it's just a lot of stuff within the visas that you just need to unpack. And there's also the complexity that, well, first of all, there's different types of visas. And second of all, there's that it depends on the country that you come from. Like the immigration system rank you from some countries to others. And it's just like really complex to even extend your visa. So it is very challenging. And usually people living with HIV in Australia that are in temporary visas, usually HIV just takes a second place on the priority, because the main worry is just surviving the day to day. Australia is very expensive for anyone on a visa.
Just before you go on to the next question, Jen, another point that I hear, and this is something that's an ongoing issue, is that here we are trying to get people to think about their sexual health or HIV prevention or looking after themselves in relation or in the HIV context. We've got to really look at context and the social determinants. They will always factor in as priorities over sexual health, and I guess that's something that we haven't really done properly in the past. And educators, workers, like myself, we think, how do I convince someone to make informed decisions about their sexual health? It's like, well, yeah, but what else is going on in their lives? So it's something we really always need to be mindful of, is that context.
And also, I reckon sexual health programs can be a lot of things. Like, we tend to think of sexual health education or sexual health promotion as making a pamphlet about STIs or screening or something. But as actually a student of mine was talking about this in a class the other day, she said often, I want to take she works with Aboriginal young people, and she's saying, I want to take people fishing and camping, and conversations about relationships and sexual health will come out of that. But when she fills in a funding application for a sexual health program that involves camping, it sort of doesn't always, it can be difficult to explain. But I think, sort of broadening, what we're talking about when we're talking about sexual health or HIV, and it might be, hanging out with people, driving them to an appointment, having a group that's not fundamentally about HIV or sexual health, but is social support. And so therefore it supports HIV. I think we need to, again, be more creative and open to different ways of doing the things we've always done, whether that's research or health promotion or health education.
And holistic, basically. Yeah. Yep.
Just wanted to, say you were right on the money with what you picked up earlier on around the experiences of non-Australian born positive folks, that migration is a key issue. And the second one is around access to care, quality care. Yeah. And I guess like people just feeling like they have some sense of health, agency around their health. I know for quite a number of the people that I've connected to, it's like, they don't have a choice to what treatment they can get. They get whatever is available to them. I mean, it's amazing that it's free, but still, they're still limited towards that. And then getting other allied health support, like even psychology, like seeing a psychologist, among other things, is still a massive issue. Trying to refer clients now, particularly in the middle of, a pandemic. Yeah. I know for quite a number of them, it takes them 3 months just to even see a free counselor. So, it's just kind of like a lot of issues do happen, and that's conflated by the fact that they feel like quite socially isolated already. So those are the three things for me. It's like migration, access to quality care, and timely support, and social support.
Yeah, absolutely. And actually, when we've spoken to people, that question around I guess social support needs, whether people are confident to engage services, what are the sort of barriers to connecting with other people living with HIV or connecting with queer community? That comes up a little bit as well, that you can sort of kind of assume that the way the services are set up or the way that support networks are set up are going to work for everyone. Which brings me to actually my next question, which is really about, do you think that the HIV sector is well set up or getting better to engage with migrant communities, people with migration backgrounds, or diverse, culturally and linguistically diverse communities?
It's getting there. You know, even just now, like as a person of color, looking at a lot of the leadership positions, a lot of the board members, board of directors for different HIV and positive orgs, it's still predominantly white. You know, I think for a lot of people of color, we're happily used for frontline work or marketing materials or focus for areas of research. But when it comes to actually setting the agenda, we're never given those seats. And instead of that, a lot of it really comes from free labor as well, free work. And we know already that so many of us don't have access or like, you know, have the most secure working conditions being migrants, being people of color. And that just basically conflates that. So for me, I've seen so many people of color, positive folks, get burnt out and leave and disengage because it's like you just feel used by the end of it. So it's like, for me, it's like great. It's great to get the funding for it, but also pay these people. Because if you're not paying them and everyone else is benefiting from that and getting paid from, you know, like engaging with them, it really, for me, it's like a system of exploitation.
Yep.
And yeah, I think it's really, it's hard because at the same time I could see, I've connected with so many people in the community that have the passion, that are really critical about these things and want to push through this. So it's really kept me on. It's honestly the only reason why I'm personally still in the sector is because I've met more than a handful of those people that I finally feel optimistic about it.
You're making me think of that. Yeah, there seems to be a good time to have a transfer of the concept that we've been using quite a bit now in HIV, where we've got the JEPA and the MEPA principles. So it's about time that, you know, we do the same thing in this area, yeah? So the greater involvement of people with HIV and the meaningful involvement of people with HIV, which is more important than just numbers, but it's about meaningful involvement. So I'm hearing that that's what's needed.
Yeah, equity is definitely a massive issue and needed, but also I think for me, it's like the resources to actually support us. Because even though you provide those structures, if you're not gonna give us the financial support, if you're not gonna give us the professional development, addressing all of these gaps and literacy issues that are affecting migrant communities, it will just become a tokenistic thing.
Yeah.
And that's something I'm very, very, I guess, sensitive to and very critical of in the movement.
Yeah, and I second what you say about payment, certainly in the research space. Like I think I've seen very, very often, many of you would agree, I'm sure, that you're paid for your expertise if you're a scientist, if you're an academic, if you're a researcher, if you're the head of an organisation, but you're not paid for your expertise as a person with lived experience. And it's like this devaluing of expertise and insight and knowledge. So it is about shifting, you know, the way we value different experiences and different forms of knowledge. And I think that's really fundamental to a lot of this. And money speaks to value in this community, in this society.
I just was thinking on how it's a huge task for the HIV sector to, you know, try to cater to so many complexities of realities and that multicultural people with HIV face. But, you know, I feel like the conversations are starting, and I do agree with Emil and I was having this conversation in a meeting this afternoon as well about how many other communities are out there that are still not visible. like, you know, like here we just maybe looking at, maybe I'm being the face perhaps for a little project for the Latin American community, Emil with the Asian community, but there's so many other communities that because there hasn't been maybe a face or a well-known person on the sector, and this is still I feel like it is also connected with, you know, with money somehow, because once you with the NACWA project, it was and I feel like with all multicultural communities, and probably Jen, you might agree with this, engaging research with multicultural communities is hard. It's hard to do that community engagement. It's hard to get those people to feel, if it is already hard for the general, you know, demographics, it's even harder because of all the barriers, you know, language, social, cultural, and socioeconomic factors. So the fact that you are able to exactly, and the fact that you're able to just give perhaps a gift card, like what I was seeing that you guys are doing for the Asian Men project. I saw when you share the screen, Jen. That's fantastic. And NACWA did the same for us, because I myself was struggling to, like, we know that the people are there because like they come to us, but once I approach them, they again, because they need to work all the time, they don't have enough motivation to do it. There's a lot of things going on in their life. That little bit of that gift card maybe could tell them, you know, we really want to facilitate your time, recognize that your input is valuable, and that's very important.
Before we continue, I just wanted to bring up something that Anth has brought up in the chat, which is worth bringing up. And Anth talked about the NAPWA's Health Literacy Framework project, which employs a participatory action research model, placing community advocates at the centre. And Anth wants to hear from Emil and Christian and Jen your thoughts on the value of that model. So this is the Health Literacy Framework project.
And that's what actually I was talking about. I was talking about how NAPWA was able to, you know, to facilitate those vouchers for us to create these activities. So the program aims to kind of understand barriers to health literacy in specific multicultural communities. And they have done it already, not only multicultural, like with different demographics. They already did it with women living with HIV. And there were a couple of peer advocates from that led that session. And from that session, there's a report that came out and it's on the NACWA website. Then they did it with Anthony McCarthy from Living Positive Victoria for heterosexual men. And as well, they have the report. There's one where Emil is part of, which is a PAN, the Asian the group, the network group. And then now I'm still working with the Latin American because we were the last ones and we are still finishing the report. But this Friday is NACWA AGM and we will be presenting in there. So there will be more information released that is going to be helpful for the sector, for those communities.
I think that model is a great model. I mean, health literacy, sorry, without getting too sort of theoretical, I guess, but you know, health literacy is often seen as making a pamphlet and translating it into different languages, and it's really not. Like, it's what we were saying before, Emil, about, you know, if someone doesn't have agency in their healthcare, if there's sort of structural things that mean people don't feel like they can make choices, if they don't have choices, they have to just be on the waiting list, then health literacy is meaningless. Like, it's no point knowing about something if you actually can't access it. So, you know, there needs to be a politics and a community movement to a certain extent. You know, peer work and community work is central to a health literacy project. So that model makes a lot of sense. And then actually using it to expand knowledge what it takes to build health literacy is you know, the best way to do research on that particular topic. So yeah, it's a great model. I'm a big fan.
I'm thinking too, it's really basic in terms of asking people how they receive information and how they use that information.
Yep.
Like you said, it's not just a simple pamphlet with written words on how to do something. It's like, well, no, ask people themselves, how do you receive information? What's the best way for you to receive information about something? How do you, you know, it's I guess they're basic questions, aren't they? Emile?
Well, what would it take for you to feel more, you know, like you had more choice and agency in your health? Sorry, Emile.
No. I totally understand. I really resonate with you on that point. And I think it's great. I think it's a really great model. Although I'm also, again, very critical of it because it's still essentially putting a lot, because then by creating this model, a lot of the responsibility is then put onto that group.
Yeah.
So, and I don't want that group to essentially burn out or, like, again, have the lacking resources or not really paid for, because again, what goes towards a lot of these groups is then, again, unpaid labor. So we need advocates who are in very, very powerful spaces that are doing those structural changes. Because as you said, Jennifer, like, it's like, great, we're improving the health literacy of our communities, but then if the structures don't actually support that, it's just kind of like when people were so into resilience, you know, everyone was just being resilient, but then the system and culture that we're part of isn't changing.
Absolutely. It's beating against a closed door and then blaming yourself for not being resilient. It just
basically
makes sense. Yeah.
And this is something that I'm very very aware of about having a group like this. Is like, this is really great, but that doesn't mean that I'm not going to keep a lot of the bigger bodies accountable for what they need to be doing, because there's so much more than just bringing us all together and having us have our little catch-ups. Because I'm done being resilient, as I always say.
Good line. Look, I think for me, it always just like there is nothing that's ever been not political about health, and particularly about HIV, and that absolutely continues. So health literacy is not a neutral, it's not just about health. It is a political concept. It's political engagement, and that's fundamentally what needs to be part of it.
I just want to thank everyone. That was really insightful. It was a great conversation, and it's quite obvious that we do need to talk more. There needs to be a lot more talking, but there needs to be more action. There needs to be more support from top down and responsibility and work from the top down. Not that all the responsibility and work falls on the shoulders of the communities. So, you know, we need a broader conversation of broader issues, broader involvement. And so I guess it's something that needs to permeate in everything we do. But thanks, Jen, Emile and Christian, for all that. And thank you all for listening in, everyone else. And hopefully people got something out of that. Also, keep an eye out for communications in our next instalment, which is Intergenerational HIV. And for more information on everything that we've been talking about, or to get in touch, you can always get in touch with me at Living Positive Victoria, and I'll pass on any messages or any information or questions onto everyone else here. And thank you, Rose, and the other comments. Just finally, before we switch off, I will, in a second, as soon as, I've got it.
Say, I will, oops, in a second.
I'm just highlighting a link in my notes to place in the chat. As always, evaluations help us. Help inform us to make sure that when we do these kinds of activities, whether it be Zoom programs or in-person workshops, groups, anything that we do, it helps inform us to make sure that, you know, what we're doing remains useful and meaningful. that's what it's all about. So if you can fill in the survey in, that'd be fantastic. Thanks again, everyone.
Thanks, Vic.
Thank you.
Yeah.
Good night. Thanks, everyone.
Thanks, everyone.
Take care.
Thank you. Bye.
Bye.